Good morning, everyone. About a half a minute, we'll get started. Good morning, everyone. The clock on the wall says 9 o'clock. It is time to begin the meeting. Could we have a roll call, please?
Kiehna.
Present.
Commissioner Kiehna.
Present?
Present.
Commissioner Marc.
Present.
Chairman Holden.
Present. All are present and a quorum exists, so the meeting can begin. Let's have a pledge of allegiance, please. I pledge allegiance
to the flag of America, one and indivisible, with liberty and justice for all. Sorry.
Okay, a quorum exists, and the first item on the agenda is the approval of the minutes from the prior meeting. Has everyone had a chance to read them?
Yes.
Would someone like to make a motion? Would someone like to make a motion to accept?
I'll make a motion.
Second.
Do we have? Okay, I heard a second from Marc. We have a motion and a second to accept the minutes of the prior meeting. Is there any further discussion? Hearing none, call for the vote. All in favor?
Aye.
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 We have 3 ayes. Any nays? No nays. Minutes are approved. First item on the agenda is the Highway Department.
Okay.
Come on down here, you get a little closer.
We'll set the speaker in front of Mike.
I do not have any plans this week. On vacation next week, and it's a holiday, 2 holidays there, 3, 4, so they won't be here next week. We'll be back.
Okay. And there's no claims to submit for the Highway Department this time, so we'll move on. Thank you very much for your report, Mike. We'll move on to General Assistance. 1 moment, please. General Assistance for the period is $500. There were no expenses for a total of $500. Does anyone have any questions? No. Could we have a motion to approve?
Move to approve.
To approve that. Amount of $500.
Second.
Do we have? Okay, we have a second. We have a motion and a second to approve general assistance, the amount of $500. Any further discussion? Hearing none, call for the vote. All in favor? Aye. Aye.
Aye.
Okay, we have 3 ayes, no nays. General assistance is approved. Next on the item is the Care Center. I have a report. Michelle, are you on?
Yes, I am.
Okay, would you like to read your report, or would you like me to read it?
You can read it.
Okay, Census 51 with 9 med aid. Okay, we have restricted all visitation and non-essential health care providers except for certain competent and care in situations such as end-of-life situations. Staff members are being screened at the beginning of their shifts, tips, and questionnaires. If any show signs of the COVID-19, they will be sent home immediately. If a resident needs to be transported to the hospital, a nurse will take the resident to the front door where they will give report and hand off the resident to MedStar unless there is an emergency situation. Dr. Calder will be testing for COVID if he feels it needs to be done. So we are looking into setting up for vital visits, frontline staff will wear a mask as long as they are on the floor. Other staff members will wear a mask if they go out onto the floor. All outside appointments have been canceled and will be rescheduled at later dates unless warranted otherwise. Residents will be put on a 14-day isolation upon admittance. Residents will be put on a 14-day isolation upon admittance. Family members are being encouraged to set up a time to visit the loved ones at the patio door. Communal dining has been canceled. Residents have their meals in their rooms. Continuing to follow all CDS, CMS, and IDCH recommendations. Educate, educate, educate. Anything else to add, Michelle?
No.
Okay. We have the claims available. Has everyone had a chance to take a look at them?
Yes.
Do we have a motion? We have a motion to approve.
I will make that motion.
Okay, Marc made a motion.
I will second the motion.
Ron seconded. We have a motion and a second to approve the health department claims. Any further discussion? Care center claims. I apologize. I'm sorry. The care center claims. Any further discussion? Hearing none, call for the vote. All in favor?
Aye.
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 Any opposed? Care center claims are unanimously approved. Health department is next.
Thank
Angela, are
you.
you on the line?
I certainly am. Good morning, everyone. I'd like to say, Michelle, thank you very, very much for all your hard work. I know that those new guidelines came down for long-term care facilities, and they're now required to wear a mask, and that's every congregate setting, including mental health. So it's getting tougher and tougher on everybody. So I want to say thank you for your efforts.
Oh, well, you're welcome. Thank you.
Mm-hmm. I'm ready to give a report.
Please do.
Okay, we currently have 15 positive cases in Randolph County. It was in 2 communities, is now spread into 4 different zip codes. We did do some investigation, and there was a common thread that we realized that led back to a public gathering, and now those people who were participants, some of them were positive, now their close contacts are positive, so the ripple kind of gets bigger and bigger. We feel like we do have a handle on it. We have got some of those infected areas, and people are on quarantine, isolated. We have multiple close contacts that are now isolated. I will share that we do have one person who's infected that is now hospitalized. We feel like we do have it under control. It all depends on those close contacts now. If they are determined to be a positive, then we will have to go back to some of their close contacts and make sure that everybody is isolated and that we have reached out to everyone to ensure that they are under quarantine. I've been in touch with Chester Mental Health, Menard, have regular conversation with our hospitals on making sure that we are prepared if we do have a larger outbreak. Other than the one individual, everyone is recovering at home. Some of the confirmed will come off of isolation this week. Department of Corrections at Menard, they have an area that's set up with 90 beds in preparation if they do have some individuals who do become infected. They do have a morgue set up, and we are discussing just initially kind of in the infant stages of getting a mobile healthcare unit set up at Menard just so that we can control transport from that facility. Chester Memorial Hospital was involved in the conversation, so they know what their capabilities are. We want them to understand that if they have an individual that is very ill, that they should consider taking them to a higher acuity facility rather than bringing them to Chester Memorial and having a risk of an additional exposure. All 3 hospitals are pulled together. We are working as a unified health system so that everybody is working in unison. We have set up a courier service between all 3 hospitals so that we can get the test down to the state lab if need be in a more organized manner. And the hospitals are now requesting tents from the IEMA for potential triage outside of the facility so that they can identify individuals who might be infected before they come into the facility. Any questions up to this point?
No, thank you. I've been getting very good comments on the excellent job you guys are doing, so thank you very much.
Yes, and I'd like to thank you as well, Angela, for the work you've been doing on this. It's been quite a difficult time, to say the least. So thank you. Yeah,
it's just a very unknown situation, and we're kind of working, kind of in the seat of our pants sometimes, but we are pulling together and working very closely. I cannot tell you how wonderful of a team I have with the hospitals, with EMS, the Sheriff's Department, the local law enforcement. Everybody has pulled together, and I cannot say enough good things about who I'm working with.
Thank you very much for all you've done. It certainly is appreciated, and obviously none of us really know where this is going to lead at this time.
Yeah.
Okay, Health Department claims. I'm sorry. Continue, Angela. I apologize.
That's okay.
Mr. Holder, I would approve the Health Department claims.
We have a motion to approve the Health Department claims. Do we have a second?
Second?
We have a motion and a second to approve the Health Department claims. Any further discussion? Hearing none, call for the vote. All in favor?
Aye.
Aye. Okay, we have 3 approvals. Health Department claims are unanimously approved. Anything else, Michelle, you'd like, Angela, you'd like to add?
I continue to stress the social distancing and the group gatherings. Whether it's in the backyard or a public place, we have to eliminate that as much as possible. It should only be for essential. I'm working with some of the larger employers in the county right now to make sure that they are following the Illinois Department of Public Health recommendations. It is so critical at this time because it is in our communities.
And one other comment I would have along those lines is I've heard of people gathering or hanging out in grocery stores or wherever just for something to do, Walmart, and that's extra potential exposure to the employees, to the other customers. Please, when you go to the stores, please get what you need and leave. And we'd like to put that out also.
Yeah, and Ron, one more comment. We had some guidelines that came down from the Illinois Department of Public Health for the grocery stores, and so they are also to put a sign out that there's to be 6 feet between anybody, and part of those were to put some signs, if at all possible, on the floor to say keep one-way traffic, basically single file in the aisles. So we're trying to get that out and making sure that people are following that.
Okay, thank you very much. Next item on the agenda is the courthouse claims. Has everyone had a chance to review and have a motion to approve?
I would make a motion to approve the courthouse claims.
I would second that.
We have a motion and a second to approve the courthouse claims. Any further discussion? Hearing none, call for the vote. All in favor? Aye. Aye. Aye with 3 ayes, no nays. Courthouse claims are unanimously approved. There are no appointments for this meeting. Next item is public comment. Do we have is there anyone on there from the press? County Journal, North County News?
Mary's here from the news.
Dan's here from the County Journal.
Thank you very much. Do either one of you have any questions or comments?
Not at this time.
Nope.
Okay. Does there anyone else have any questions or comments? Yes.
This is Allison with the Farm Bureau. I just wanted to say that Randolph County Farm Bureau is collecting masks from the farmers to donate to the health department. You can drop them off at our office or at the health department, or call me or text me, and I can do a porch pickup and we can figure something out. So.
What are you asking for? I'm sorry. This is Angie.
We're collecting masks from the farmers that they would have in stock from like harvest or cleaning out bins to donate to the health department.
Thank you so much.
No problem.
Melody, you have something?
Yes, the part would look like it's fit anymore because we're so focused on COVID-19. But the primary election will be officially closed on the 7th of April. The numbers we have at the moment, and these are, there will be no change in numbers between now and the 7th, is that there were 4,186 ballots cast in Randolph County. That was a roughly 20% turnout, and expenses came out to about $7.80 a ballot. Total cost of the election, $32,518.79. The math is actually $7.77 a ballot.
Thank you very much. Are there any other public comments out there?
This is Ronnie White. I have a list put together, and I will email it to the press for the small business and employment issues. We have a list of the Illinois Small Business Development Center at SIU down in Carbondale, Illinois State Senator Paul Schimpf's office, Illinois State Representative Nathan Rice's office, and Illinois Congressman Mike Boss's office. Also, we have been putting out, and if people want to get daily updates or updates as soon as we get information, the Community Foundation of Randolph County and the Progress Committee of Randolph County are both forwarding business information and other information as they get it. So is there any questions on that at all? In press, I will email this list to you to get out, because we've been, at least I know I've been getting quite a few phone calls and questions of who to call and what can be done and who actually understands a lot of this legislation coming out almost daily. So these are people that can help.
Thank you very much, Ron, Commissioner Ron. Any other public
Hey,
comments?
this is Dave, this is Shannon Wolf. Just wanted to let the public know that the restrictions as far as entry into the courthouse are going to remain in effect until May 4th. And they can still do business by coming into the front of the security area and requesting any kind of paperwork or anything they need from any one of the individual offices. It'd be best to call first and call that office, such as a county clerk or whoever, and let them know what they need, and they can have it ready for pickup at the front security door.
Thank you very much, Sheriff. Any other public comments? Okay, hearing none, we have one item of new business on the agenda, and this is a raffle license for Illinois Ducks Unlimited, not-for-profit 501c3 Wetlands Conservation, to be held at Shawneetown Trail, Steelville, Illinois. Do we have any questions or comments on it?
When is that going to be held?
It's going to,
I believe it's a continuing raffle.
Oh, okay.
Yes, it appears to be a continuing raffle.
It's a continuing raffle, says from June to December. So I'm sure if they're not open because of the restrictions, there won't be any raffles.
Okay.
Do we have a motion to adopt, to approve the application for raffle license?
I will make that motion.
Okay.
I will second that motion.
We have a motion from Commissioner Kiehna, a second from Commissioner White. Any further discussion? Hearing none, call for the vote. All in favor? Aye. Aye.
Aye.
Okay, we have 3 for, none opposed. Raffle license for Ducks Unlimited is approved. Is there anything else that anyone would like to bring before the board at this time? Hearing nothing, do we have a motion we have no executive session, do we have a motion to recess until our next meeting on April 17th, 2020 at 9 a.m. to be held in the same fashion as this one? Motion to recess?
I'll make that motion.
Second.
Have a motion and a second to recess. Any further discussion? Hearing none, call for the vote. All in favor? Aye.
Aye.
Stand in recess until April 17th, 2020 at 9 a.m. to be held the same as this one. The necessary call information will go out in advance. Thank you very much, everyone, and have a wonderful day.
Thank you.
Goodbye.